Gardner, Medical Officer of Health with the Simco Muskoka District Health Unit, providing the COVID-19 update for Simco Muskoka. So as of today, we have on our website 267 confirmed cases of COVID-19. 148 of these have recovered. 8 are presently hospitalized. We've had 15 deaths to date, so no new deaths. When I reflect on what's changed since I last reported to the media on Monday, at that point we had 259 reported cases, so we are up by a total of 8 cases, taking us to our 267 total. Now, a little later on, I'm going to provide a little bit more information about additional cases that have come in over the evening in relation to one of the outbreaks. So just if you could keep that in mind as I go, that would be helpful. So if you look at the new cases, the 8 new cases, one is associated with the Bradford Valley long-term care facility outbreak. A staff member, woman in her 50s, who is self-isolating. This takes our total number of staff cases to 11, 7 living in Simco Muskoka and 4 living out of our health unit, therefore not included in our line listing. We have 1 additional case at the Owen Hill long-term care facility, a staff member, female, in her 40s, presently self-isolating. We have 1 new institutional outbreak, and this is in Wabasheen at the Bayview Retirement Home. It was declared yesterday with 1 individual, a staff member, who's a case. And that means that in total we have 5 active institutional outbreaks, as well as the 1 group home outbreak that I've mentioned before in Bradford, West Gwillimbury, and we've had 1 long-term care facility outbreak that's resolved. If you look at the remaining 5 sporadic cases that have occurred in the last 2 days, they range in age from their 30s to their 50s. All are self-isolating. None have been hospitalized. 1 is a community acquired, and 4 are under investigation, and all of them have occurred in Simcoe County. We've also had 4 cases recovered in the interim in the last 2 days. Now, I'm going to provide a little bit more information about the Owen Hill outbreak. The last time I spoke with you, we had a total of 2 cases, 1 staff and 1 resident. Last night we had some additional cases reported to us, so we actually have a total of 11 cases now, 4 staff and 7 residents. So those additional cases are not on the line list. You won't see them in the tally. We've done a tremendous amount of testing ourselves, hospitals assisting with this, other agencies assisting with this. And so what I'd like to report is that we've had a grand total of 1,237 tests done to date. Bradford Valley, we've done approximately 465 tests in the institutions in Barrie at IOOF, Woods Park, and Owen Hill. A total of 758 tests have been done, a good number of those have come back. I'm not sure how many remain as outstanding, but we've had a very large number of tests that have come back, and the great majority of those have been negative tests. If I draw your attention to our Health Stats website, if we draw, scroll down, we see that the average age, the most common age to be affected is people in their middle years, 35 to 64. and that the second most common age is 65 and above. You've also got the recovered cases. Yeah, yes, yes.
Running in the background.
Okay, perhaps you could address that, Leslie. That'd be great. Thanks.
Please mute your phones. We're hearing a Facebook Live in the background. Thank you.
Thank you very much. That's very helpful. If we look at all of our cases, we've had 148 that have recovered. We have 67 that are self-isolating. We have another 28 that are isolated, associated with long-term care facilities. We have 8 that are hospitalized right now, and a total of 15 that have deceased. And if you look at where people acquired their infection, the largest number are community acquired at 91. And I would say that most recently, community acquired and contacts of other cases has greatly dominated over travel related. This speaks to ongoing transmission in our community and the importance of people doing the physical distancing. We've had success in flattening the curve, and it's because people have cooperated with this. It's took a lot of effort on everybody's part to do so. It's not been easy by any means, but it's really been helpful in reducing and preventing a surge that otherwise would have overtaken our healthcare system. So I encourage people to continue with that physical distancing, 2 meter setback from other people, avoiding crowds, carefully considering whether you need to be going out or not, hand washing frequently, and if you develop any symptoms, you need to be putting yourself in isolation, seeking assessment and getting tested, checking in with the assessment centers to be sure that they'd be able to take you on for testing. Less and less are we seeing travel related, simply because travel really is largely shut down. But if in fact people are still returning from travel, they need to be mindful of the fact that they're required to go into self-isolation for 14 days under the Federal Quarantine Act. If they develop symptoms, they need to be assessed. If we look at our epidemiological curve, it is showing a bit of a sawtooth pattern, but mostly level. Not a great surge in cases over time, which is the result of everybody cooperating with the physical distancing, flattening the curve. So once again, congratulations to everybody. And I always want to commend my staff for their hard work in helping to achieve this with the case and contact management that they're doing every day, and following up with cases and their contacts and having them go into self-isolation. And also the provincial government for its policies that it's put in place about restricting public access to public amenities and closing non-essential services and keeping schools closed. All of that has been critical for our success to date. And we have to keep it up, because if we stop, you'll end up with a surge, it'll end up coming back. I'm just going to walk through a few notes that I have. We've had a question with regards to temporary foreign workers on farms and what we're doing to safeguard them and to prevent the potential for transmission of COVID-19 from them. We do know that COVID-19 is around the world, affecting countries all around the world, and so not only is it circulating here in our community, but it's elsewhere, and people traveling into the country to work are a cause potentially of concern, and so we need to manage that risk. As a health unit, we've had an ongoing mandate for years to ensure the safety and the sanitation of the working conditions and accommodations for temporary foreign workers on farms. And so with COVID-19, we have an enhanced role in managing that. We have reached out to all of those farms in our district and have made them aware of the requirement for all migrant farm workers coming into the country to go into isolation for a 14-day period to be monitored for symptoms and to be assessed if they develop any symptoms, and that they're to do so in conditions that would allow for this isolation. Also, they are to be housed so that they can maintain the physical distancing that we all need to be able to maintain. We've got information on our website to help them manage the task of keeping conditions that are safe. And just for your information, we know of a total of 116 of these accommodation sites for foreign farm workers in our district. There was a question about herd immunity, natural herd immunity, and what that's all about and what role that could play with regards to COVID-19 and our control of COVID-19. So the Chief Public Health Officer, Dr. Teresa Tam, has spoken about this before. And the concept there is that if you get enough people in the population who are immune to COVID-19, then you break the chain of transmission and it can no longer continue to transmit freely in the community and can no longer be a threat to people in the community, or at least that it's a greatly reduced threat to people in the community. And there are two ways of achieving this kind of herd immunity. One way is through infection, people becoming infected with the virus and then recovering from the virus. And even there, we aren't sure how long-lasting that immunity is. We're not sure whether it's everybody that would have it or only a certain proportion of people who are infected who would retain that immunity. So that's a big question mark for us. And certainly we're trying to avoid people getting infected because it's a severe virus and has a high case fatality rate, particularly among those that are vulnerable, those that are older, those that have pre-existing medical conditions. So it's a highly undesirable way for us to achieve herd immunity. The other way of achieving herd immunity is through the development of a vaccine, the provision of a vaccine, with a big uptake of the vaccine in the population. And as I've said before, from our knowledge, it looks like it's going to be like a year and a half or so before we would have that, and then we'd have to deliver it to the population. So unfortunately, I think we're going to be a ways away from having effective herd community in our herd immunity in our community. I think people can raise the question, what about future waves of this pandemic? We are going through the first wave of the pandemic, and I have positioned before that we can expect, after we've recovered from this first wave, that we could have other waves to come until we end up with a vaccine. And so the question would be, after that first wave, aren't you going to have a lot of people immune? And the answer to that is that we don't know for sure, because we don't have the studies yet to show what proportion of the population is getting immunity from this. But studies that have been done in other jurisdictions have suggested that it can be quite low. It can be 2 or 3% of the population that gains immunity because of the fact that we flatten the curve with the physical distancing. We are effective in breaking the chain of transmission with that physical distancing and therefore spared the great majority of people from becoming infected. We had to do that to avoid many people being severely ill and the potential for a surge overwhelming the healthcare system. But one of the unfortunate effects of it is that we don't develop herd immunity that way. And even in places that have been severely hit by COVID-19, such as New York City, the herd immunity level, the level of immunity in the general population is perhaps up to 20%, but it really means that the great majority of people are still vulnerable. You can still have transmission happening in the community if we don't have those other precautions in place to flatten the curve with future waves. We've had we've provided some information about the overall testing that's been happening in the long-term care facilities and the status of those long-term care facilities. I'd be happy to take some detailed questions about that in a little bit of time from now. But I do need to acknowledge that at the health unit, we ourselves have had 2 of our staff test positive for COVID-19. This, of course, is something that I deeply regret. These individuals, from what we can see, acquired it in the community. There's no evidence that there was transmission at our facility, or at least we don't have that evidence yet. We do screen our employees before they come to work. They do a self-screening themselves, and when they arrive at the door, there's screeners to check, to question people as they come in. But that can only pick up people when they have symptoms, and we know that for 48 hours before the onset of symptoms, people can be shedding the virus and potentially infectious to other people. So once you pick up a case, you've got to look back 48 hours before that to see who they've been in contact with. And indeed, we've done that with regards to those 2 employees of ours, and we've identified that there were a very limited number of people at our work site who are potentially exposed. We've identified who they are, and they've been put into self-isolation, waiting to see if anything comes of that, if there's any evidence of transmission in those people or not. We've maintained a high degree of repeated cleansing in our offices. And of course, we've notified all of our staff of this. We've notified our Board of Health of this. And one of the really important safeguards for us with our staff is getting as many people as possible working from home. The more of our staff who are working from home, the less likely it is that there'll be people going to the office who are pre-symptomatic cases. The lower the numbers at the office, the less of possibility of that happening, and also enables better physical distancing at the work if there are fewer people there. So we continue to push in that direction with our staff. We've got the capacity to have over 200 of our staff working from home, and over 100 of our staff indeed are working from home. We continue to push that as a way of safeguarding them. Just a few other things. I had indicated before that the province had announced support for community gardens, and that they were looking to local public health to guide how they should be operated to safeguard against transmission of COVID-19. So we anticipate that later today we'll have our guidelines on this up on our website, and then we'd be pushing that out to our municipalities and to other stakeholders for their use. We had a question last time about septage application on land and concerns about the potential for aerosolization or vaporization of this leading to infection of COVID-19. I indicated that, to my knowledge, was aware that COVID-19 is shed in feces, but there's been no evidence of transmission via that means. I also indicated that septage, which is treated sewage, has been treated such that it doesn't transmit pathogens. But I also indicated that we would look to the literature just to check on all of that and see if there's any new evidence about this. And what we found was basically a corroboration of what I had said without any new additional information to add on that. We've also found in the media or from contacts with us that there's some question about the use of gloves by members of the public when they go out grocery shopping and whether this is helpful or not or necessary. And I've spoken to in the past about gloves, and what I say is that gloves should be used for the care of COVID-19 patients, used once for the care of that individual patient, and then removed properly with hand washing, along with the other personal protective equipment that's required to provide care for COVID-19 patients. So they are not helpful otherwise out in the community or for food handlers. in that they tend to impede or discourage washing. What you really need to be doing is frequent hand washing. If you're wearing gloves, are you washing the gloves instead? That's not a practice that we're recommending. We're recommending that you're not using the gloves. Instead, you wash your hands. If you're relying on gloves, the gloves can become contaminated by touching surfaces just like your hands can. And then if you end up touching your face, you're transmitting to yourself or potentially transmitting to other surfaces. And so my advice is don't wear the gloves, wash your hands. There was a question about testing for COVID-19 at RVH at the center that they had set up for testing, and I'd indicated that in following up on that, we found out that that was something RVH has set up to facilitate testing for those who've been to their emergency department as a follow-up, and we found out that as of Monday, they had tested a total of 1,088 individuals. And then there was a question about RVH's field hospital that they are constructing, and under what conditions would we see another spike or surge in cases in our region. So what's the I guess the thinking behind that? I would say that that really goes back to being prepared for future surges. We know that with this first surge, we really had to put elective procedures in hospitals on hold. And of course, that had its own negative effects on people's health and well-being and access to the services they need from hospitals. And therefore is highly undesirable. And if we are going to see future waves of this pandemic, it would be far better if we built in the capacity in our healthcare system to be able to manage those waves while also keeping up their other services to avoid having to lose those elective procedures with future waves. So RVH is establishing its field hospital, its pandemic response structure for that purpose, and I commend them for this. I'd advise them that this would be a good idea, that it would be a form of insurance to make sure that the community would continue to get its healthcare services during future waves. I'm aware that other hospitals are looking at similar or analogous sorts of options to be able to do the same, and I would say that RVHs could serve as a regional support as well. So I think it's a very good thing that that's happening. And then under what conditions would we see another spike or a surge in cases in our region? Well, I would say that that really speaks to the province's de-escalation plan that was just released, that talked about conditions criteria under which they would consider reducing the control measures that are in place and the approach to reducing those controls. And what's inherent to that is as you reduce those controls, you could potentially have a resurgence of cases again. And so we would all need to be on our guard for that and be prepared to put those controls back in place again, and to deal with a surge that could come related to that. So the hospitals would need to be ready with their additional capacity. We in public health would have to be ready with our response of case and contact management and telephone calls, and general system advice and guidance. That's all of us would need that ability to kick in again if that were to happen, or it depends on to what degree it would happen. If we're very sophisticated about it and responsive about it, then any future serve would be greatly reduced compared with the one we have now, because we'd be onto it right away. But regardless, I think that there's no doubt when this present surge has been brought under control, that there will be a relaxing of these measures, because they're hard on us, they're hard on the economy, they're hard on society. There's going to have to be periods in which we relax all of that to get back to more normal life. There's a question here about why are long-term care, retirement, and group homes so vulnerable? Very good question. part of the answer would relate to the people in them. So long-term care facilities have people who are older and people who have serious medical conditions, and they are more vulnerable to the impacts of COVID-19. We see more severe manifestations in them. They're more likely to have severe outcomes or require hospitalizations and much more likely to die from this. And so if you create a population of people like that together, then there's a much greater likelihood that if it gets in, it's going to have a huge effect or a very serious effect on many people in that facility. So bringing those people together is one issue. Another issue would be the design of such facilities. They vary in design. The older homes, by their design, might have more than one individual per room, and so it's difficult for people to have their privacy and to exercise within those facilities the physical distancing that's required of us all to reduce risk. So an older home that's more crowded by design with more than one person per bedroom is going to be at a higher risk as well. There are other congregate settings that could certainly be an issue. Group homes may very well have vulnerable populations in them depending on who's in the group home. They could have people with pre-existing medical conditions that put themselves at risk. They're smaller in size, so that would make it a lower risk, but you still have a congregation of people together, and depending on their design, they might be more crowded. It would depend on the individual home. So there's some potential there as well. And I would say that correctional facilities are also a vulnerable situation because of the large size and the potential for crowding of individuals once again, and that inmates in correctional facilities might very well have pre-existing medical conditions themselves that would put them at higher risk.